So you started Ozempic, Mounjaro, Wegovy, or even Zepbound, and now you're wondering, what should I be doing to make sure this actually works? This stuff works, but how? A few days ago, I posted a video called 10 Things You Should Never Do on Ozempic, and it's already helped thousands of people avoid the most common pitfalls with the GLP-1 agonist. But avoiding mistakes is just step one. If you want to lose weight safely, keep it off, and feel your best while taking a GLP-1, this video right here, this one, is for you. These are 10 things you should absolutely be avoiding while on Ozempic, backed by research, clinical expertise, and what I'm seeing working every day in my practice with the 300 plus consults we do a month. So let's get into it. Tip number one, start your day with protein. This tip sounds simple, but it's game changing. When you start your day with protein, you activate satiety hormones, stabilize blood sugar, and drastically reduce the chance of cravings later on in the day. GLP-1s suppress appetite. Newsflash, yes, but protein amplifies that effect and it helps preserve lean muscle when coupled with resistance training, which is key if you want to keep weight off for the long term. I recommend aiming for 30 to 40 grams of protein at breakfast for your first meal of the day. That could be eggs, Greek yogurt, protein smoothies, cottage cheese, whatever works for you in the protein realm. And if you skip breakfast and don't get protein until 2 p.m., you've actually just missed a big window for appetite control. So start early on in the day and your metabolism will thank you later on. Tip number two, create a structured eating routine. You'd be surprised how many people take Ozempic and think, hey, well, I'm not hungry anymore, so I guess I'll just graze or skip meals. No, don't do that. But your body still thrives on rhythm. Eating at regular intervals helps your digestion, your hormone balance, and your energy levels, even if you're eating less. Structure still matters. I tell my patients, treat your meals like appointments. Keep them consistent, even if they're smaller, and your body will respond with more stable blood sugar, better energy, and smooth digestion. Don't forget, practice mindful eating as well, slowing down the food eating process to savor your food and take note of textures and flavors, and the experience of pairing one food with another is a great technique to increase satiety while you eat. You get fuller quicker, eat less. Tip number three, drink water like it's your job. Dehydration sneaks up really fast on you on GLP-1 medications, and these drugs don't just reduce appetite, they blunt your thirst signals as well. I see patients come in with fatigue, dizziness, headaches, and it turns out they're barely drinking water. The goal? At least 2 to 3 liters a day, more if you're active and live in hot climates, or actually are eating a high protein diet, which is super hard to do. A simple trick, drink a full glass of water before every meal. It supports digestion and gets you closer to your hydration goal without having to think about it all day. Tip number four, strength train 2 to 4 times per week. Ozempic helps you lose weight. Another news flash, but that weight isn't always just fat, and the medication will not make you actually work out. That part is on you. Without resistance training, you will risk losing muscle, and that's a problem. Muscle is what drives your metabolism. It improves insulin sensitivity. It helps prevent regain. You don't need to lift heavy weights all the time or follow a bodybuilder plan, become Mr. or Mrs. Olympia or anything like that, but body weight squats, resistance bands, push-ups, all these exercises count. Utilize increased reps until you can actually lift heavier weights if that's your goal. 2 to 4 short workouts a week can actually protect your muscle and help Ozempic do its job more effectively. Tip number 5, get 7 to 8 hours of quality sleep. And let's not underestimate this tip. Lack of sleep increases cortisol, reduces insulin sensitivity, and raises hunger hormones like ghrelin. Greedy ghrelin. Yeah. Even if your GLP-1 is doing its job, poor sleep can override those benefits. If you've ever noticed you're more snacky or foggy after a bad night of sleep, this is why. Create a consistent bedtime routine. It's called sleep hygiene. Cut off your screens an hour before bedtime. Keep your room cool and dark. Studies have shown the temperatures between 60 to 67 degrees Fahrenheit to be optimal to support restful sleep. Bet you didn't know that. Personally, that's too cold for me, but it might be just right for you. Remember, prioritize recovery the same way you prioritize high protein meals and movement. Tip number 6, watch your alcohol intake. Alcohol plus GLP-1s equals a rough combo for a lot of people. These medications slow digestions, which means alcohol tends to sit in your system just a little bit longer and it works a little bit harder on your system. And that can increase nausea, disruption of blood sugar, and impair your judgment around food, snacky foods. And honestly, most people don't realize how high calorie alcohol drinks can actually be. One cocktail can set you back about 300 to 400 calories without even making you full, not even the slightest. So I'm not saying never again, I'm saying strategic moderation. Know your tolerance and plan around it. Tip number 7, said this before and I'm gonna say it again, eat more fiber, especially from whole foods. Fiber supports everything from digestion to hormone balance. Soluble fiber found in things like chia seeds, oats, beans, berries, all these things slow down gastric emptying and improves blood sugar control. Sound familiar? Right. It's the same exact mechanism that GLP-1s use to improve your metabolism. I tell patients to aim for at least 25 to 30 grams of fiber per day, and if that sounds like a lot, start small. Add chia to yogurt, swap white bread for whole grain bread, and throw some lentils in your soup. Fiber doesn't get enough of the spotlight in my opinion, but it plays a big role in your results. Tip number 8, manage stress before it manages you. Here's something I see often. Someone doing everything right. They're eating well, exercising, taking their GLP-1s like they should, but they're constantly stressed and they're not losing weight. That's because chronic stress is not only a common trigger causing many people to overeat, it actually raises a substance called cortisol, which makes your body hold on to fat and seek out comfort foods. You don't have to become a Zen master or anything like that, but you do need to plan around stress, not just through it. 5 minutes of deep breathing, a daily walk, journaling, prayer, if that's your thing, whatever grounds you. Make it a habit, not an afterthought. Tip number 9, track your habits, not just the weight. The scale is one data point, but it doesn't show the whole picture. Weight fluctuates for at least a dozen reasons that we can think of right away. Water retention, muscle gain, inflammation, digestion, changes in your habits, stress, we just said that. Don't panic if it all stalls or even goes up a little bit. Instead, track your behaviors. Ask yourself, did I hit my protein goal today? Okay, did I move my body? Did I go to bed on time? Am I stressed out? What's happening? Where is my mental health meter at? Where am I at with my mental health? Who can I talk to? Those are the metrics that lead to long-term transformation, not just the number on the scale, okay? These are the habits that are going to take you well past the GLP-1s. Tip number 1, get support. Don't do it alone. You don't have to figure this out by yourself. The people who succeed on Ozempic, Wegovy, and Mounjaro are the ones who stay informed, they stay accountable, and stay consistent. They're telling you they're taking the medications, but they're not telling you about the other little things that they're actually doing great. And that's exactly why I created my free GLP-1 bootcamp. It's a 14-day program with expert tips, my complete GLP-1 nutrition guide, recipes, mindset strategies, and everything I give to my private patients on a daily basis. It's 100% free and it works. You'll find the link below. And if you're looking to start medication or switch providers, I've also included a link to my prescription program where qualified patients can get Wegovy or Zepbound shipped directly from the manufacturer. And that's after getting an evaluation by me. So stay healthy, stay informed, and I will see you soon.